Have you observed a decline in your leg strength since turning 60? Do you find yourself needing to push off your knees to stand up? Is climbing a flight of stairs starting to feel like a weightlifting session? Perhaps you've noticed an occasional loss of balance while simply walking across your own living room. Many attribute this to the inevitable process of aging. However, the truth is more specific. This is often one of the earliest signs of sarcopenia, or age-related muscle loss. It creeps in silently without pain or swelling until one day you realize you need help getting out of a chair. The good news is that there is a solution. It has been shown that leg strength can be regained in a remarkably short period, not with strenuous exercise or expensive treatments, but with the aid of just 3 crucial vitamins. By providing the right nutrients at the right time, you can make a significant difference. This video will detail the 3 essential vitamins every senior needs, explain how their deficiencies lead to heavy, weak legs, and show you how to combine them safely and effectively for a rapid recovery. This information is not based on hearsay. It is supported by clinical studies, scientific research, and decades of professional expertise. Stay with me until the end, and I will also reveal a vitamin schedule that is highly effective yet followed by very few. After the age of 60, your body undergoes a gradual yet significant transformation. Your bones become more susceptible to fractures, your blood circulation slows, and your muscles, particularly in the legs, begin to weaken. Most people are unaware that the legs are typically the first area to show this weakness, making simple activities like standing or walking a challenge, even when they feel well and maintain a normal diet. According to the American Geriatric Society, individuals over 60 lose between 1% and 3% of their muscle mass annually. This means you could lose up to 15% of your leg strength in just 5 years without even realizing it. So, what causes this decline? There are 3 main factors. The first is vitamin deficiencies. As we age, our digestive system becomes less efficient at absorbing nutrients, and our stomachs produce less acid. This results in lower levels of vitamins D, B12, and B1, thiamine, all of which are vital for muscle contraction and nerve function. The second cause is poor blood circulation. When your circulation is sluggish, your legs receive less oxygen and fewer nutrients, leading to premature fatigue, frequent cramps, and a heavy, tired feeling in your legs. The third factor is reduced physical activity. Seniors tend to walk less or avoid stairs, causing leg muscles to weaken and shrink over time. Furthermore, without the proper nutritional support, muscles cannot fully repair and regenerate, even with regular movement. The promising news is that by replenishing these 3 key vitamins, you can restore your leg strength in a matter of days. Let's explore each vitamin in detail to understand its function, starting with the one that most older adults neglect. Vitamin D3 acts as a master switch, reactivating leg strength. It is more than just a vitamin. It functions like a command key that reboots your entire muscular, skeletal, and neurological systems. Herein lies the problem. After 60, your body's capacity to produce this vital nutrient plummets. Your skin thins, you spend less time in the sun, and your liver and kidneys become less efficient at converting vitamin D. As a result, your body's crucial systems begin to power down. Your muscles weaken, your legs feel heavy, you move with less agility, and most alarmingly, you start to lose your balance, all because of a subtle deficiency in vitamin D3. Why is vitamin D3 so critical? It is widely known for aiding calcium absorption, which is essential for strong bones, but its role extends far beyond that. It ensures proper contraction of your muscle fibers, facilitates smooth communication between your nerves, and most importantly, prevents the silent muscle atrophy that occurs with age. Without adequate D3, your body becomes like an old machine with unreliable parts, weak and unsteady. How can you identify a vitamin D3 deficiency? Symptoms include leg weakness, especially when climbing stairs, fatigue from standing or walking, nocturnal leg cramps, difficulty with rapid turns or steps, and significant pain in the hips, knees, or heels. Some individuals may also experience mild anxiety, irritability, and trouble sleeping. These seemingly minor symptoms are often mistaken for aging, but are in fact early warnings of a vitamin D3 deficit. What does the science say? Researchers from the University of Birmingham in the UK studied individuals over 65 and found that after just 5 days of taking 800 IU of vitamin D3, participants' leg strength increased by an average of 19%. Another study from China demonstrated that seniors who took a D3 supplement and engaged in light exercise showed significant improvements in leg power and balance within weeks. Furthermore, researchers at Harvard's Geriatric Research Center discovered that older adults with low vitamin D3 levels were 40% more likely to fall or require hospitalization compared to those with normal levels. The message is clear. Vitamin D3 protects not just your bones, but your independence. How does it achieve this? When your D3 levels are restored, your body absorbs calcium more efficiently, promotes the growth of new muscle fibers, enhances muscle contraction and response time, reduces latent inflammation in muscle tissue, and allows for smoother, pain-free movement. In essence, vitamin D3 reactivates your muscles and joints. What is the recommended dosage? For healthy individuals over 60, experts recommend 800 to 1,000 IU daily. For those with a history of falls or signs of frailty, 1,500 to 2,000 IU per day is often advised. For optimal absorption, take vitamin D3 under medical guidance in the morning or early afternoon, always with a meal containing healthy fats such as salmon, eggs, or olive oil. It should not be taken right before bed, as it can interfere with sleep. Can you get enough from food alone? Unfortunately, it's challenging. A 100-gram serving of fatty fish contains about 500 IU, a single egg provides only 40 IU, and a glass of fortified milk has around 100 IU. It would be impractical for most seniors to consume enough fatty fish, eggs, and milk daily to reach 1,000 IU from diet alone. This is why supplementation is often necessary. Who should consider supplements immediately? If you are over 60, spend limited time outdoors, feel unsteady, or have a history of falls, have osteoporosis or joint pain, or follow a plant-based diet low in fish and dairy, vitamin D3 should be a top priority. A few important warnings. While D3 is generally safe, excessive long-term use, over 4,000 IU daily, can lead to problems like nausea, constipation, headaches, elevated calcium levels causing kidney stones, or, in sensitive individuals, irregular heartbeats. The key is to use the correct dosage at the right time and monitor your levels regularly. Vitamin D3 is the switch that can help older adults restore their leg strength, reactivating muscle systems that have quietly declined over the years. When taken correctly, you can feel a difference in days, stronger legs, lighter steps, and renewed confidence with every move. Next, let's discuss vitamin B12, which restores balance, nerve health, and leg confidence. It is one of the most critical yet frequently overlooked supplements for individuals over 60. While many know B12 for its role in energy and memory, its importance for leg strength is less understood. B12 is essential for the communication pathway between your brain and your muscles, particularly those in your legs. It is responsible for maintaining healthy nerves, coordinated movements, and quick reflexes. When B12 levels decline, this communication becomes fuzzy, and the first signs often appear in the lower body. What happens with low B12? You might experience symptoms like numbness, tingling, or a burning sensation in your feet, weakness in the legs, especially when standing or walking, a feeling that your legs are asleep or not responding, and difficulty balancing, even on a flat surface, leading to unsteadiness or the need for walking support. Some people also experience mood swings, mild depression, forgetfulness, and brain fog. These symptoms often develop gradually, and many seniors attribute them to aging. However, they are classic signs of a B12 deficiency. Why is deficiency more common in seniors? There are two main reasons. First, poor absorption. As we age, our stomachs produce less acid, especially if you take acid-reducing medications like omeprazole or ranitidine. In this low-acid environment, it becomes harder to extract B12 from food. Second, a restricted diet. Vitamin B12 is found almost exclusively in animal products like meat, fish, eggs, and dairy. If you eat less meat or follow a plant-based diet, you are more vulnerable. Even with a healthy diet, your body may not absorb enough, which explains why B12 deficiency is so common in those over 60. What is the scientific evidence? Numerous studies have linked inadequate B12 to mobility issues in older adults. A study from Oxford University found that seniors over 65 with low B12 levels walked more slowly, had significantly poorer balance, and were more than twice as likely to fall in the following year compared to those with normal levels. In a randomized trial published in the Journal of Gerontology, seniors were given 1,000 mcg of vitamin B12 daily for 8 weeks. After supplementation, participants reported reduced numbness and instability, improved lower body strength, and faster reaction times. B12 not only helps you think clearly, but also keeps your body balanced and in control. How does vitamin B12 work in the body? It aids in the formation of the myelin sheath, the protective coating around your nerves. This allows for rapid and precise signals from the brain to the muscles. It also supports red blood cell production, which enhances the oxygen supply to muscle tissues and is crucial for energy metabolism. When you are deficient in B12, your nerves malfunction, your muscles misinterpret commands, and your legs begin to feel disconnected. Who is most at risk for B12 deficiency? If you are over 60, regularly use antacids, follow a vegetarian or low-meat diet, take metformin for diabetes, suffer from digestive issues like gastritis or IBS, consume alcohol regularly, or have had weight loss or gastrointestinal surgery, you are at a higher risk. A simple blood test can determine your B12 levels. Some people may not experience the typical tingling or numbness. Instead, they might notice clumsiness, dropping objects, mild headaches, fatigue that doesn't improve with rest, or sporadic pains or buzzing in their feet. These are all warning signs. The sooner you act, the faster you can recover. What is the recommended dosage? For people over 60, a daily dose of 500 to 1,000 mcg of methylcobalamin is safe and effective. Methylcobalamin is the active form of B12, meaning your body can use it directly without conversion, which is particularly beneficial for seniors as conversion rates decline with age. It is available in sublingual tablets, sprays, or chewables. It is best taken in the morning or with lunch, as coffee and tea can interfere with its absorption. Can you get enough from food alone? In theory, yes, but in practice, it's unlikely. A 3-ounce serving of beef liver contains about 70 mcg, 3 ounces of salmon has about 4.5 mcg, 1 large egg has only 0.5 mcg, and a cup of milk has about 1 mcg. You would need to consume large amounts of liver, fish, or dairy daily to meet your needs. For most seniors, a supplement is the more practical choice. Is it safe? B12 is water-soluble, meaning any excess is flushed out of your body. It is extremely safe, even at high doses, with no known toxic level in healthy individuals. However, if you are on blood thinners or have chronic kidney disease, consult your doctor. Otherwise, B12 supplements are one of the safest and most effective ways to boost energy, improve nerve function, and regain control over your legs. Many older adults report feeling steadier on their feet, regaining sensation, standing up with more confidence, and even sleeping better once their nerve symptoms subside. Vitamin B12 is a movement vitamin. It reestablishes the connection between your brain and your body. When those communication lines are clear, your legs feel stronger, your muscles react faster, and your confidence returns. Finally, let's talk about vitamin B1, the secret to anti-fatigue and muscle energy. You now know that vitamin D3 strengthens muscles and B12 connects nerves to your legs. However, there is one more piece to the puzzle: thiamine, also known as vitamin B1. If D3 is the switch and B12 is the wiring, vitamin B1 is the power source, providing the actual energy your muscles need to move. Without it, your body runs out of fuel, even if your bones are strong and your nerves are firing correctly. What is vitamin B1 and why is it so important? Thiamine is essential for energy metabolism. It helps convert food, especially carbohydrates, into usable energy in the form of ATP. Every breath, every movement, and every muscle contraction is powered by ATP. Since your legs contain the largest muscles in your body, they require a constant supply. When your B1 levels are low, your muscles feel heavy, fatigue quickly, and recover poorly. Symptoms of a potential vitamin B1 deficiency include weak or extremely tired legs, even with minimal activity, muscle cramping, especially in the calves or feet, a heavy or dragging sensation when walking, shortness of breath when climbing stairs, and occasional lightheadedness or exhaustion after standing up. Some people also experience mental fatigue, a lack of appetite, and a general disinterest in moving. These are classic signs of a slowed muscle metabolism, in which B1 plays a significant role. What leads to B1 deficiency in the elderly? Several factors contribute. One is reduced absorption from food as our digestive systems age. Another is medication use. Diuretics, often prescribed for high blood pressure or heart conditions, cause B1 to be flushed out in the urine. Metformin and antibiotics can also interfere with B1 levels. Alcohol consumption, even in moderation, can hinder the absorption of B1. Finally, a diet high in processed foods, which are often stripped of B1, can lead to insufficient intake. What does the research show? A 2021 study from Tokyo University found that over 30% of the 300 elderly participants had low B1 levels. These individuals also had significantly less leg strength, moved more slowly, and frequently complained of muscle fatigue. After B1 supplementation, most showed a marked improvement in energy, walking distance, and stair climbing ability. In a study from the journal Neurological Sciences, patients with chronic leg fatigue received 100 milliliters of thiamine daily. After just 7 days, 82% reported improved endurance, and 68% reported less heaviness and pain in their legs, with no side effects. How does B1 support your legs? Vitamin B1 fuels the Krebs cycle, your body's main energy-producing pathway. This allows your muscle cells to generate ATP more quickly, recover from movement faster, and maintain their strength and tone. B1 also facilitates the transmission of nerve signals, especially in the peripheral nerves that control your legs and feet. Without B1, it's like trying to run a car without gasoline. Everything is in place, but nothing moves. What is the recommended amount? The standard dose is just 1.2 milligrams per day for men and 1.1 milligrams for women. However, for therapeutic benefit in older adults with symptoms, much higher doses are often used. Doctors frequently recommend 50 to 100 milligrams daily for seniors with leg weakness, fatigue, or nerve issues. The good news is that B1 is water soluble, so any excess is safely excreted. When and how should you take it? Consume B1 in the morning to support energy levels throughout the day. It should always be taken with food, preferably a meal with some protein or healthy fat. Avoid taking it with coffee, black tea, or alcohol, as these can block absorption. Can you get enough from your diet? Yes, but it requires conscious effort. Excellent sources include whole grains like brown rice and oats, legumes like beans and lentils, pork, organ meats, and sunflower seeds. However, many seniors don't consume enough of these foods daily, and certain medications or conditions can impede absorption. Therefore, a supplement can be a more reliable option if you've been experiencing unusual fatigue. Who should consider supplementation? If you have type 2 diabetes, take diuretics or metformin, consume alcohol regularly, experience leg fatigue with light exertion, or have unexplained weight or appetite loss, you should have your B1 levels checked or consider restoring them with a safe daily dose. Is it safe? Yes, thiamine is known to be very safe, even at high doses, and is considered one of the safest supplements for seniors. However, always consult your physician before starting high-dose B1, especially if you are on medication or have kidney or liver issues. Many seniors report feeling more energized after just 3 to 5 days of taking B1. Legs feel lighter, walking becomes easier, climbing stairs is less taxing, and the desire to be active returns naturally. It's like adding fuel to an engine that has been sputtering. While vitamin B1 may not be as well known as D3 or B12, for older adults struggling with low energy, muscle fatigue, or leg heaviness, it can be the missing piece that makes all the difference. It powers your muscles, restores your drive, and gives you the energy to move through your day with purpose and ease. How can you combine these 3 vitamins for the best results? Now that you understand the individual roles of vitamin D3, vitamin B12, and vitamin B1 in supporting your muscles, the question is how to combine them for maximum benefit. The key lies in timing and simplicity. Let's start with when to take each vitamin. Vitamin D3 is best taken in the morning, right after a breakfast that includes a source of healthy fat like yogurt, eggs, or a small amount of avocado. D3 is fat soluble, so it requires fat for proper absorption. Vitamin B12 is most effective around midday or in the early afternoon. Since B12 also promotes alertness, taking it too late might interfere with sleep. Avoid taking it with coffee or tea, which can hinder absorption. Vitamin B1 is your morning fuel. Take it with your first meal of the day, ideally a balanced breakfast with whole grains and some protein. It will support your energy levels and even improve your focus throughout the day. Here is a simple daily example. For breakfast, have a small bowl of Greek yogurt, 1 boiled egg, 1 vitamin D3 capsule, and 1 vitamin B1 tablet. For lunch, have grilled salmon or tofu with steamed vegetables, along with 1 vitamin B12 tablet or lozenge. This setup ensures your body gets the right nutrients, in the right amounts, at the optimal times. What about a multivitamin? If you already take one, read the label carefully. Many senior formulas underdose these 3 crucial nutrients. Ensure it contains adequate amounts of D3, B12, and B1. Also, keep in mind that multivitamins contain both water-soluble and fat-soluble vitamins, so it's still best to take them with a meal, preferably in the morning or at lunch, and never on an empty stomach. Finally, more is not always better. Always follow the prescribed dosage and consult your doctor or pharmacist, especially if you have a chronic condition or are on medication. When taken correctly, these 3 vitamins work together like a well-oiled machine to bring strength, balance, and vitality back to your legs and your life. Safety advice and precautions are crucial. Like any tool, vitamins are powerful for restoring health, but must be used with care. Here are some important safety measures to keep in mind, especially if you are over 60. First, do not increase the dosage on your own. Just because something is natural does not mean more is better. Taking double or triple the recommended dose will not yield faster results and can be harmful. For instance, since vitamin D3 is fat soluble, taking too much, 4,000 IU or more per day, without supervision can lead to excessive calcium levels over time, which can cause nausea, constipation, kidney stones, or even confusion. Second, be cautious if you have kidney or liver issues. These organs are responsible for processing and eliminating excess vitamins. If they are not functioning properly, even standard doses can accumulate and cause adverse effects. Therefore, if you have been diagnosed with chronic kidney disease, fatty liver, or another serious condition, consult your doctor before starting any supplements, particularly fat-soluble ones like D3. Third, some vitamin side effects can be subtle. For example, high doses of vitamin B6 taken for months can cause tingling or numbness in the hands and feet. While rare, it is more likely to occur with unmonitored use. Excessive vitamin D3 can cause headaches, muscle cramps, or a poor appetite long before more serious issues arise. Always be mindful of any small changes in your well-being, especially after starting a new vitamin. Lastly, get your blood levels tested. If you are taking D3 or B12 long-term, it is a good idea to have a simple blood test every 6 to 12 months. This helps ensure you are in the safe and effective range and are not inadvertently taking too much or too little. In conclusion, vitamins can undoubtedly improve your quality of life, but the key is to be smart, informed, and cautious, especially as we age. When used correctly, these 3 simple nutrients have the power to transform your strength, mobility, and independence. Let's review for a moment. If your legs have been feeling unsteady, heavy, or weak, it is not just your imagination. It is not just aging, and most importantly, it is not irreversible. We have seen how vitamin D3 strengthens your muscles and bones, how vitamin B12 improves your nerves and balance, and how vitamin B1 replenishes your energy and stamina. Together, these 3 simple vitamins form a powerful trio that can help you reclaim your strength, confidence, and freedom of movement. The secret, however, is that you must take the first step, whether it's consulting your doctor, taking a supplement in the morning, or monitoring your blood levels. Action is always better than waiting. I would love to hear from you. Have you tried any of these vitamins before? Did you notice a difference in your strength, balance, or overall energy? The more we learn from one another, the stronger we become together. Please share your story in the comments section. Thank you for watching. Take care of your body, fuel your legs, and keep moving forward, one powerful step at a time.